All right. I like to get the hard question out of the way first. For records purposes, we need you to say and spell your first and last name and list your official title so it's attached to the claim.
Sure. Dr. Michael Warren, Michael, Warren, Warren. I'm the Associate Administrator for the Maternal and Child Health Bureau at the Health Resources and Services Administration.
Wonderful. So first of all, let's talk about, this event, what's going on, this roundtable discussion, and what the purpose and the goal is today.
We are so excited to be here in Alabama today to bring together grantees who are doing work here to improve maternal and child health. Those are programs that we fund out of the Health Resources and Services Administration to make sure that regardless of where people live, they have access to strong prenatal care, a safe, high-quality labor and delivery, and the best chance at a really healthy and successful first year of life.
And you just touched on something. Why here? I mean, this is Bibb County's very rural, so.
We know that folks who live in rural areas can face barriers in accessing care, whether that's prenatal care, whether that's labor and delivery services. And so some of the grants that we support, like the Health Center here, provide that really invaluable prenatal care to make sure people get the health care that they need to have the best possible pregnancy and birth moving forward.
Why now?
We are in the midst of a maternal health crisis in this country. When you look at the number of women who die every year, either during childbirth or during that first year following childbirth, when we look at the percentage of babies born low birth weight or infant mortality rates, babies who die during their first year of life, we've got a lot of work to do. These grantees who are here today are doing amazing work here in Alabama to make a difference, and we're excited to learn from them.
And we've got, it looks like a lot of cards at the table, a lot of people here. You know how many people were expected to be participating in this discussion?
So we're anticipating about 40 folks around the table today. One of the things that's been great as we've gone across the country doing these events is hearing from our partners in the community what's working well, what are their challenges, what can we learn about how better to support them. And so we will have home visitors here, we will have folks from the health centers that we fund, folks who are doing maternal health innovation projects to improve maternal health across the state, and we're just thrilled to be here and learn from them.
And being in other locations, having similar discussions, what is working well and what's not working?
One of the things that we hear over and over at these events is the power of partnerships in communities. So we've seen, for example, when a health center sits across the table from a home visiting program, they think about opportunities to make referrals between the two. So maybe a home visitor learns about a health center in their community and they've got a patient who needs prenatal care or care for a well child visit. They're able to make that connection. The health center staff who are in the room learn, hey, I've got this home visiting program that I can refer my patients to. That far and away, that power of those partnerships has been one of the strongest things we've seen at these visits.
And any other locations in Alabama that's going to have a similar roundtable discussion that you're aware of? Or?
So this is our visit to Alabama. This is our 11th state so far, and we're excited to be here with everybody today.
Awesome. Anything I didn't ask you, sir, you want to add or say?
No. Okay.
Great. Thank you so much again for your time.
Thank you. Yeah.